Hello, I'm Rebecca Canham, a Principal Investigator for this Protect National Core Study, looking at factors affecting the use of face coverings within retail consulting rooms. The project explored knowledge, attitudes and behaviours concerning the use of face coverings within retail consulting rooms amongst workers and members of the public. You may have seen or been a part of this research, and in this short video I would like to share some prominent findings amongst hair and beauty workers specifically. 52% of our survey responses were provided by hair and beauty workers, along with 4 of our 18 interviews. Some characteristics of our study sample in hair and beauty workers include most being employed by independent businesses and 85% living in England. 31% of hair and beauty workers reported themselves to be clinically extremely vulnerable and or having received a positive diagnosis for COVID-19. 80% reported wearing disposable face coverings, and over half of hair and beauty workers said that they provide their own face covering worn when at work, which was the highest proportion amongst worker subgroups consulted. They also reported the greatest amount of time being spent in the consulting room when compared with other professional subgroups, with nearly 60% reporting spending more than 8 hours in the retail consulting room. What we found was that hair and beauty workers had the highest self-reported knowledge of the pandemic and recommended face covering usage practices, such as effectively putting on a face covering or disposal after use. They were the professional group least likely to report face coverings to be easy to wear. Commonly reported benefits across worker and public participants were increased protection from the COVID-19 virus for themselves and others around them, as well as positive judgment from others. Communication challenges were the most commonly cited challenge across worker and public participants, in particular within noisy environments. Hair and beauty workers were most likely to report that face coverings did not reduce their COVID-19 risk, and least likely of all worker and public participants to wear a face covering if this were not mandated by the government or their employer. Hair and beauty workers surveyed said that the wearing of face coverings impacted their professional identity, and almost half said that the wearing of face coverings lowered their mood, which was considerably higher than other worker subgroups. As a result of our study findings across worker groups and members of the public, a number of recommendations have been proposed for policy, practice and research, with consideration for the current time, potential future variants of the COVID-19 virus, and future pandemics that may arise. Many of these are generic to worker and public populations, but some specifically relate to workers within hair and beauty. If you'd like to read more detail on the findings or recommendations from this project, these will soon be made available on the IOM website and the Protect National Core Study website under sector-specific studies. Thank you.